Where is the sign-up sheet?
She's grabbing it right now.
Oh, okay. Just FYI, we've got the sign-up sheet coming for those of you who want to speak. But we're going to go ahead and get started. This is the non-civil subcommittee. And we also have a full committee meeting after this. And we've got several bills in this subcommittee as well as the full committee. So we're going to try to limit time on and I understand we're doing very important work, but we need to make sure that we're kind of conscious of everybody's time. So for sponsors, I'm going to give 5 minutes, and anybody else that wants to speak on the bill, we're going to give 3 minutes. The first bill we're going to consider is Chairman Newton's House Bill 487. Oh, go ahead.
Thank you. Thank you, Chair Lady. House Bill 487, I'm working off of LC 339411S, is a bill to address what has been a pervasive problem across many areas of healthcare, which is violence against healthcare workers. It can threaten the safety of staff, patients, visitors in the hospital, and other healthcare facilities. It's a big issue with employee turnover. And so the Joint Commission on Accreditation of Hospital or Healthcare Organizations, Joint Commission, has recommended strongly that hospitals and healthcare facilities work hard on addressing potential violence to healthcare workers. It's felt to be a significant workforce issue in healthcare, in particular our nursing staff and others, those in behavioral health. Good news, there was a study committee with Department of Public Health. It was led by the Senate in this particular case, in 2021 to look at violence against healthcare workers, and one of the outcomes of it was a bill which did offer some protection to emergency department workers because that is one of the lead places, along with behavioral health, where these kind of assaults and threats seem to take place. What House Bill 487 does is recognizes that even though the majority may take place in the emergency department, workers across the healthcare spectrum are exposed to threats and acts of violence that have tremendous detrimental effect on workforce, job retention, and situations such as that. It is often patients, but it can be other customers or visitors, a coworker, and other people. So violence against healthcare workers is fairly pervasive, and it is a very real problem that we would like to address. As an emergency physician myself, I've certainly seen my share of challenges with our nurses trying to do the best they can, especially now that wait times are higher than we would like due to staffing shortages. Protection against violence is a very valuable thing, and actually additional security has been added to almost all our emergency departments as well. House Bill 487, like I said, would extend the protection that currently exists for emergency department workers and would extend it to all healthcare workers. Be glad to answer any questions about it. It does just include an expansion of who in healthcare is protected by this law. Currently, as I mentioned, it is healthcare workers in the emergency department. This would make it in any healthcare facility.
Okay, thank you, Mr. Chairman. Members, any questions? All right, we've got one question from, I don't see, Representative Miller.
Thank you, Madam Chair. Good afternoon. Thank you for this bill. I just had a question about the scope. I see that healthcare worker is defined, and maybe I missed it, and if I did, I'm sorry. Where is healthcare facility defined?
I'm sorry, hang on. The
20?
Line 20.
it'd be line 21, a hospital or another healthcare facility licensed pursuant to Chapter 7 of Title 31.
So it's defined as a facility licensed pursuant to?
Correct.
Can you tell me just
My
generally?
understanding, I apologize, it's but largely a hospital type facility.
Okay. So would that include doctor's offices or urgent care centers or?
I may have to ask if someone else is familiar with that code section, more familiar than I am. Apologize. It's a good
I'll see
question.
if it's
Oh,
in here.
well, thank
I
you.
may have it, I may not. Thank you, Madam Chair. I'll look to see.
Okay, any other questions? All right, and we have, I believe, few people that have signed up to speak, or at least one. Is Jill Travis in here? Yeah. All right. Jill with Gactyl. And again, Ms. Travis, as I said, if you can limit your testimony to 3 minutes.
I'll be less than that.
Thank you.
I appreciate your time, members of the committee. I'm not going to belabor the point because you guys have heard me testify about healthcare bills before and singling out victims. I want to express to the committee my appreciation to Chairman Newton for speaking with me about this bill. The only change that we would ask the committee to consider making is on line 63 to make that 3 years instead of 5 years. If you look at the aggravated assault code section and you look at the aggravated battery code section and you notice that there are distinctions between victims that are classified and there's different kinds of punishments that are imposed, they're always the same. The punishments mirror one another. So we would ask that they mirror here too, to be 3 years. That's my only request.
Yeah. All right, thank you, Ms. Travis. And any questions from the members? I don't see any questions. Thank you. Okay, we're going to hold this one for now, Doctor. And if you can stay with us for a little bit. Or do you have somewhere else to go?
Present a couple bills in health.
Okay, and we'll keep you, we can keep you posted. Thank you.
Thank you.
I do have a quick announcement. I know House Bill 47 was on our agenda. We have taken that off of our agenda today at the request of the author. Our next bill will be, is Representative Ballinger in here yet? Oh, they've taken that one off. Okay. So House Bill 463 is also off at the request of the author. All right. Next bill will be Vice Chair Matt Reeves. House Bill 446.
Good afternoon, Chairwoman Floor Leader Hong and committee members. This is House Bill 446. This is a bill to get tougher on drive-by shootings, to get them out of Georgia. I'd like to thank the majority leader for starting the effort on this drive-by shooting bill. He, of course, is a former Gwinnett County Assistant District Attorney and is now in private practice, but someone he knows in the District Attorney's Office, Brandon Delfunt, who's the Chief Assistant DA in Gwinnett County, has identified a rising number of drive-by shootings in Gwinnett County and also a rising number of issues where the current state of the law has some drive-by shooting cases falling between the cracks, and I'll elaborate on that in a minute. I'd also like to thank Superior Court Judge Warren Davis, who's been on the bench in Gwinnett County for most of my career. Before that, he was the Chief Magistrate Judge in Gwinnett, so he signed warrants and got to see criminal activity, and he's alarmed about the proliferation of drive-by shootings in Gwinnett County over the years. And Judge Davis is also a former police officer, so he's got perspective of this crime proliferating. So this is a grassroots bill. It's been brought from a local community and real-world problems with the current state of the law from outside the perimeter to down here in the Gold Dome, and I hope we can get this done this year to get tough on drive-by shootings. I won't ask for a show of hands, but in this room, think about how many people their bedroom or their living room or their kitchen is at the front of the house, or their kids or grandkids. We're all in danger if drive-by shootings continue to proliferate, of being harmed and being having our life endangered. Additionally, drive-by shootings can have ricochet and crossfire, and have cars that are getting shot at in addition to houses. And you can have people who were nowhere near the targets of this violence get seriously hurt or killed. In Georgia, the law right now in 2023 should make it clear that people are entitled to be safe inside their own homes and cars. And these drive-by shootings are a threat to human life. It's wartime level violence that we need to get out of Georgia. This is not just a gang bill. I want to thank those of y'all who've been here and worked on gang bills in the past. We got a good, tough gang law. However, there are drive-by shootings where gangs aren't involved. Pretty much, most gang members are probably doing drive-by shootings, but some of these drive-by shootings are not done by gangs, and it's something to be tough on whether or not there are gangs involved. And so you think about drive-by shootings, 30 years ago, it's something that you'd see on the news, halfway across the country, and then we started seeing it in highest crime areas in Georgia, and now you've got it, small towns, mid-sized towns, the suburbs, all over metro Atlanta. Just turn on the 11 o'clock news and you're going to see it. Talk to your police, talk to your prosecutors, and you're going to hear, in all likelihood, what I've heard from my judge and my chief ADA. This is something that's happening way too often. We need to get tough on it. This will let you go home to your counties and towns and tell them that you're taking a stand against drive-by shootings. The Bill of Rights and Second Amendment, they protect law-abiding gun owners. Drive-by shooters, they are not law-abiding gun owners. They're putting people in danger. It's a serious gun crime, and we need to send a clear message to people considering doing drive-by shootings. Don't do it in Georgia. You need to pack up your guns and drugs and take that out of the state, or you're going to spend a long time in prison. So why are the laws currently on the books not adequate? We've got an assault and battery statute. We've got a criminal damage to property that endangers human life statute. But those statutes, as my locals in Gwinnett County have pointed out, and by the way, they're top-notch. They do a great job, and they're doing the best they can with what they have to work with. But those statutes were designed to have a specific victim. And these drive-by shootings, these are bold and heinous acts of intimidation and violence that are indiscriminate. And sometimes there's nobody home. Sometimes they don't know who's home. They're just out there, shooting at homes and cars and putting people in danger. You're going to hear, I believe, from a prosecuting attorney's counsel attorney who had a case where a teacher got hit with ricochet from some other drive-by shooting. So this would give a clear jury instruction, a clear charge on drive-by shootings, and to say enough's enough, and we're going to move the needle in favor of law-abiding homeowners and residents, and away from people who are out there, doing drive-by shootings. And think about the police, think about the prosecutors, think about the folks on jury duty. They could benefit from more specificity. That's something you did with the hate crime law. It's something that has been done already in other scenarios. Having a specific, well-defined statute that makes it clear that drive-by shootings are something that won't be tolerated in Georgia. One real-world hypothetical about why aggravated assault, criminal damage to property, and endangering human life. Here's an example. This guy got out of jail in Cobb County. He was a member of the Sewer 13 gang, and he didn't like Norteño gang members. And he had been in prison for a while, so he wasn't back to doing gang activity. But his rival gang had red was their color. So he went around shooting at cars that were red in people's driveways or parking lots, whether or not there was somebody in the car. And so that falls between the crack of the current laws that we have on the books. However, this statute would make that a serious crime, and he'd be back in prison rather than riding around shooting guns at red cars and in a way that's going to hurt people in all likelihood. This bill was well vetted. We had the locals, and then we had prosecuting attorney's counsel. I reached out to Ms. Travis. She has taken a look at it. They do not support it, but the lines of communication have been open on it. And it's good public policy to stop this heinous crime that threatens people in their homes and out on the streets. I believe in criminal justice reform and having second chances. But somebody who's going to be bold enough to go do drive-by shootings, this is something to be punished and restrained, and to have the full weight of Georgia law telling them you can't do that in Georgia. So a new drive-by shooting law is needed. It would be beneficial. It's something we need to go ahead and do now. Don't wait until next summer. We have 6 more months or so before we get back in, and there's more drive-by shootings on the 11 o'clock news. Let's put a stop to this now and send this over to the Senate and try to get this on the books. Got some folks here from the Prosecuting Attorneys Council, John Reagan, who is prepared to talk about this, and I could either let him present or take questions now, whatever the chairwoman and the committee prefer.
Sure. Thanks, Vice Chair. We're going to take questions from our committee members first. We've got a few here. Chairman Smith.
Thank you, Madam Chair. Vice Chairman Reeves, how much criminal practice have you done?
I did third-year practice back in law school, and have done civil practice in my career. And my dad retired 5 years ago from being in the Southwestern Circuit as a prosecutor for about the same amount of time I practice now.
But your only criminal defense, your only involvement with the criminal side of things was in your third-year practice?
Correct.
Okay. Did you ever handle an aggravated assault case while you were there?
I actually worked in the Northern Circuit where Chairman Leverett is, and we had a lot of child abuse cases and theft and things like that, aggravated assault.
But not drive-by shootings?
No, they didn't have any drive-by shootings that whole time I was in the office in Danielsville and Comer and that area up there. So back in the 20 years ago, that was not something you had on the outskirts of Athens.
Okay.
There were some heavy marijuana grow operations going there, I think, due to the going to sell it to college kids, stuff like that, but no drive-by shootings.
All right. So let me ask you this. Is it your position that Georgia law does not provide for the prosecution of drive-by shootings as it currently stands?
You can try to do it under aggravated assault, battery, criminal damage to property with intent to endanger human life, or if they've got a bunch of pervasive gang evidence to where you can show they're a gang member, then you could get involved in the gang statutes. But there's not a well-defined statute that makes it clear whether the house is unoccupied, whether the car is unoccupied, that a drive-by shooting is a crime.
Do you know how many?
It's a crime that's severely punished.
Do you know how many acquittals or guilty pleas that have been had in drive-by shootings in this state over the last year?
Not in the state. However, the folks in Gwinnett tell me that with the increasing numbers of drive-by shootings that are coming in, there are an increasing number of creative arguments tailored towards the current statute that is letting people wiggle out of it. To the level of this, they were saying, well, I was just filming a rap video. I'm an artist. I wasn't out there doing crime. I knew nobody was home. I wasn't intending to hurt anybody. I was just shooting a gun at that unoccupied house, stuff like that.
Okay, so you're not aware of any acquittals and or guilty pleas outside of Gwinnett County on a drive-by shooting case?
Specific numbers, no, but here's what worried me about Gwinnett. They were saying it's something that's happening more than once a week, almost daily now. And that thing about the guy getting out of jail and shooting up the red cars, that's the kind of story that I'm hearing about. That was in Cobb County with the guy shooting at the red cars.
Okay, and that's just one instance outside of Gwinnett County?
No. I think Prosecuting Attorneys Council could talk about the statistics and the numbers better than I can.
Okay.
And the increasing level of drive-by shootings. Also, just from watching the Atlanta news, during my adult life, it's become a lot more frequent.
Let me ask you this. Wasn't Bobby Potter y'all's DA up there? What was his name?
Danny Porter.
Danny Porter, excuse me. I don't know how I mixed that one up bad. Y'all have a new DA now?
We do.
Has she tried to prosecute any
Yes.
of the drive-by shootings?
Yes.
Okay.
Has
Has she been successful?
Mr. Delphont, the chief ADA, they certainly have success, but they've identified this as a weakness and something where the bad guys are getting away with bogging down cases under the current state of the law, and both a judge and a prosecutor sincerely believe the current state of our law is not adequate anymore to handle this new crime that's in bigger numbers that was happening, was not happening here 30 years ago at the numbers it is, and there are cases that are falling between the cracks legally. They think there's a gap in the law to solve.
Is
So
it a
it's not as
gap?
much as, go ahead.
Is it a gap in Gwinnett County or the whole state?
I think I'll let the prosecuting attorney's counsel talk more about that. Gwinnett was proactive and identified it and brought it to the Capitol, but I think it's something that small towns, mid-sized towns, urban areas all are suffering from and subject to. Same arguments under the aggravated assault and battery and criminal damage. If somebody's not home, if the car's unoccupied, somebody's going to get a lenient or is subject to getting a lenient sentence for a serious crime that threatens the life of people in the neighborhood.
Okay. Representative Miller?
Thank you, Madam Chair, and thank you, Representative Reeves, for your bill. I was Chairman Smith asked a good portion of the questions that I was going to ask. You probably knew that. So I understand that you have had conversations with, and I know ADA Delphont. He's a great prosecutor. He's also a very good one. I can't imagine that he, with the tools that we've had in this code for way back when I was a prosecutor, has been unable to successfully prosecute either an aggravated assault that someone commits from their vehicle. I mean, can you tell me a little bit more
Yes.
about why he
Yes.
has found it difficult
Well,
to do that?
If you don't have a specific victim or if the home is unoccupied, that's going to be difficult to say aggravated assault.
Right, that wouldn't be an aggravated assault.
Right.
But that would be
but
something
the
else.
The teacher who's out, tending to her garden in the back and gets hit with a crossfire from that non-aggravated assault drive-by shooting, that's what this bill would prevent from happening and would punish.
So is it your belief that if a person fires a gun from their car toward a house and hits a person that they don't see, that it's not aggravated assault?
No. The ricochet. I intended to shoot an unoccupied home. I just wanted to, send a message to the neighborhood. And if that bullet ricochets off the house and hits somebody down the street, the current state of the law doesn't clearly enough address that.
Well, I will tell you that.
He would say, I didn't intend to hit anybody. I just shot at the house.
And
I knew nobody was home. That's the kind of defenses that they're facing.
I understand
with these
that,
increase in numbers.
but you would agree with me that the law as it is currently written, that would not be a viable defense. In other words, if you shoot a gun towards a house and you hit somebody,
Nope.
that's
It's-
not an aggravated assault?
If you shoot across the street and then it ricochets and hits somebody on the other side of the street who was nowhere near that house, I think under the current aggravated assault statute, that is subject to a defense.
Okay.
And also, think about that. The police officer, the prosecutor, the defense attorney, jury duty, jury instructions, motions, that's an awful lot. That's something we can tie up and make clearer and stronger through this bill.
One more follow-up, Madam Chair. So an aggravated assault is basically using a gun, which is a deadly weapon, that either is likely to or actually does result in serious bodily injury, whether or not you intended to shoot the person. I mean, a person will always have the defense of accident. They're going to always argue that, but it is still an aggravated assault.
Again, assault has a victim, and if the victim is in the opposite direction of where the gun was fired, that's something where they would say, no, I didn't even know that person was there. I was shooting at that house. I wasn't shooting in the opposite direction where the bullet ricocheted. I mean, it's a gap. It is something that this bill would clear that up and would make sure that we have a drive-by shooting law in Georgia that's going to cover crossfire, ricochet, and times when the home and car is unoccupied.
What about a ride-by shooting on a bicycle or a moped or a motorcycle or a golf cart?
Well, that doesn't happen in frequent numbers. This bill covers people who are shooting out of a car or immediately get out of a car and shoot. That is what is happening at increasing frequency, and that's what this bill is designed to put a stop to.
I guess my point is, and then I will yield.
And if somebody wants to do a moped bill next year,
Understood.
they're welcome to do that. But
Understood.
this bill is at the thing that happened in California 30 years ago and then has had an increasing level here in Georgia. We want to put a stop to it through this bill.
I understand, but I guess I'm just trying to understand the logic of expanding our code. We've heard testimony from Mr. Skandalakis from PAC about how our criminal code has ballooned over the years and how it has become at times an unwieldy tool for prosecutors, and that when there are sufficient laws on the books that allow prosecutors to do their jobs, it is sometimes counterproductive to just add more bloat to the code. And I guess what I'm trying to understand is, if we're going to, when we have a statute like aggravated assault that is broad enough to encompass all the assaults, no matter where they occur from, how does it help prosecutors to add this new level of law that we don't have jury charges on? We have not had it thoroughly vetted by courts of appeals like we have our aggravated assault statute. How is this actually productive, and how does this actually
Sure.
make us safer?
Great questions. Number one, Prosecuting Attorney's Counsel had a hand in drafting this bill and is here to testify in favor of this bill. So this is not an unnecessary addition in their view. Number two, just like the hate crimes bill, there may have been things where you can have sentences, but this gives more specificity, and it says we don't want this happening in Georgia anymore, and we're going to have increased criminal consequences for drive-by shootings that don't have a specific victim like assault and battery and the current statutes have. It is tailored more towards a deadly crime that is increasing more, and it doesn't bloat the code. It works within current statutes, aggravated assault and otherwise. It sort of explicitly includes drive-by shootings and several other criminal statutes. So it's not adding other unnecessary crimes on the books. It's merely giving more specificity. Thanks.
Okay. All right. Thank you, Vice Chair Reeves. And did you say you had somebody here to speak?
Absolutely. Is John Reagan from Prosecuting Attorney's Counsel the one who's going to speak to it?
Okay.
John Reagan, who I'm from suburban Atlanta. He did prosecution in Macon drive-by shootings. So.
Okay.
Good
Welcome
afternoon. Good
to.
afternoon.
Thank you.
Good afternoon. It's my pleasure to be here. As I said, my name is John Reagan. I'm the gang resource prosecutor at the Prosecuting Attorney's Council. I've been there since 2019. From 2001 to 2019, I was an assistant district attorney in Macon and prosecuted there. And I've prosecuted over 15 years of violent crime. So I'm here to just answer. Representative Reeves asked me to give a story. Just a story. As I said, I prosecuted in Macon. Drive-by shootings are prevalent in Macon. Two cases stick to mind. One, we had a shooting. It was gang related, and the defendant used an assault rifle. The rifle, as he fired it, one of the rounds went about 500 feet down the street and killed a 73-year-old retired PE teacher as she walked into her kitchen in the middle of the night to get a glass of water. It was a perfect timing, but it hit her right in the side. We didn't find her till the next day when we did a welfare check because nobody heard about it. The second case, again, was a gang-related drive-by shooting where a young girl was killed, completely missed the target and killed her, and I was charged with prosecuting both of those cases. So drive-by shootings are on the rise. They are prevalent all over Georgia. So
Thank you for coming and testifying. We do have one question from a member, Chairman Smith.
John, it's so good to see you again.
Good to see you, sir.
I tell you, we got to work on this New Way hot dog stuff.
Yes, sir. Yes, sir.
I just we're getting short here, and you know that helps our temperaments a little
Yes, sir.
bit. Anyways, I'm glad you came today, and I appreciate that. And let me ask you about that. Did those cases end up with any kind of prosecution, or have you ever prosecuted successfully any drive-by shooting?
Yes, sir. The case involving the young girl, I prosecuted personally, and that resulted in a conviction to murder. The case with the teacher is still pending in front of the Superior Court of Macon, so I don't really want to talk. I have resolved some pleas out of it. The main shooter, however, is still on trial.
Okay, thank you. Our hearts and prayers are with those families.
Thank you, sir.
Thank you, John.
Thank you. Okay. And I think we have Ms. Travis signed up to speak. Ms. Travis.
The chairs. I come with
you.
company today. This is Arturo Corso. He's a lawyer, a GACTA lawyer and former prosecutor from Gainesville, and he's joining me. I did have a brief opportunity to speak to Representative Reeves about this bill, but I didn't get into the weeds because I didn't know that this was coming today. So I don't want to say anything that's surprising to him, but I would just say that we did not have a full discussion. As some of the committee members are picking up on, we feel like the law currently covers this. We know these instances happen over and over and over again, and prosecutors are able to prosecute and get convictions for these crimes. There is some weird drafting stuff that goes on, and I'm not going to get into the weeds of where I can see some holes and some overlap and some inconsistencies in the drafting in light of the hour of the day and the serious business that you're taking up. I will note that on line 69, we're talking about serious bodily injury, but we're not defining it. Of course, we don't like mandatory minimums, which are lines 75 to 83. I think that Mr. Corso can give you more illustration of how these crimes could be prosecuted under current law, and therefore we don't feel the need for this bill.
Okay.
Good
Thank you.
afternoon. I think the representative who asked the questions already covered and demonstrated that she knows exactly what I'm going to say, so I'm not going to spend time on that as much. But I think what is obvious to me is that this bill, particularly Section 1, basically what it does is raises the mandatory minimum sentence from 5 years to 10 years. It's already 5 to 20, so this bill makes it 10 to 20. That might be of some concern to those of you who value separation of powers, because what we're doing there is taking away the power of the judge to sentence and tailor a sentence to a particular case. I haven't heard, in my career, I haven't heard about these types of cases being unable to be prosecuted. And I think the questions about, you basically were talking about transferred intent would absolutely cover a ricochet. But then there's another thing that I only have just discovered while sitting here, and that is while lines 20 through 22 give us a 10 to 20 year statutory framework for sentencing, the identical conduct is covered in lines 61 through 66, same conduct, but in 67 and 68, the punishment is still 5 to 20. So what the Supreme Court calls that is a conflict in statutory sentencing, or a violation of the rule of lenity, and it is unconstitutional because it gives the state of Georgia the opportunity to choose which statutory framework they will prosecute under. The rule of lenity says that when two statutes punish the same conduct and provide for different sentences, an accused is entitled upon conviction to the lesser statutory framework. So I think this needs just maybe a little bit more reconciliation, but I would say the easiest way to deal with it today would be to table it, and I don't know if that's the right word, but give us some opportunity to talk further with the sponsor, who I'm sure would welcome some assistance. Thank you.
Thank you for coming. And we don't have any questions. Thank you, Ms. Travis. I don't see anybody else signed up. We are going to take up those concerns, and Vice Chair Reeves, I think we can all get together and try to hash those out. So we're going to keep this as a hearing only. Thank you. That's the only one left. Okay. All right. The next bill we're going to take up is House Bill 253, Representative Montahan. Okay. And I believe we've got a substitute last minute on this. So if you can tell us what that LC number is as well.
Cobra's in. I got the Pawnee County DA here with me.
That's fine. Do you want him to come and sit? I'm
Yes,
okay
please.
with that.
If that's okay with you, Madam Chair, come on.
Welcome. Good to see you.
Well, thank you, Madam Chair, and congratulations. It is good to be back in the House of Judiciary Non-Civil. It's a great place, and it's looking better this year, I think, than last year.
I hope you mean that.
I'm just looking around. This is a very prestigious crowd of folks, and so thank y'all for having me. Quite honored. So the LC version is LC 480900S. Just make sure everybody's got a copy of that. If not, there is a copy here on the table. I checked before we got in. Chairman Hall,
Yes.
proceed. So I'm going to present this bill now. I will say, Chairman Smith had a few questions for the previous presenter. I did not do criminal law in my third year of law school because I'm not a lawyer. So I hope that clarifies things right out the rip.
That's why you asked me up here.
And that's why I've got a real lawyer next to me to maybe translate not only what I'm saying, but what this law says. I'll tell you the major points about the bill, if I may. And it's a serious bill. I know. We oftentimes you'll find me in jest and kid around, but this is a very important bill, a very important subject. I think that is now affecting too many Georgians. Let's be frank. This past year and years, I've worked with my sheriff. I've worked with my good DA, my friend Matthew Rollins, and around a cup of coffee, we were discussing the amount of overdose deaths and overdoses that the Pawnee County Sheriff's Office and the coroner were having to take on a daily basis. And we found that we were having multiple overdoses and sometimes multiple deaths in a single county every single day. I don't think there's probably a person in this room today whose family or friends have not been affected by a fentanyl overdose. I know that I've seen it in my community. I've seen it in the far reaches of my family. And it's incredibly sad to see the amount of loss of life of these young people in our communities. So with that being said, I know it's an important change. I know it's something that could have great impact in the state of Georgia. Number one, we're going to look at the different changes that we're making. If you see on lines 13 through 16, the 16, 13, 26 is a list of Schedule 2 drugs. Let's see, 16, 13, 25, I believe, is a Schedule 1 drug listing. And what we're doing here with this section is basically saying, with more specificity, that was a word I just learned from the previous presenter, we are trying to tackle this issue of fentanyl being distributed and added into other types of drugs, or not added into other types of drugs. Because fentanyl is a very powerful drug. If I can, for a moment, paint a picture of how powerful fentanyl is, if I were to pour a packet of salt on the table, 3 small grains of salt in the form of fentanyl would be enough to kill you today. 3 small grains, very powerful drug. So when we're talking about substances like grams in terms of fentanyl, we've got to think about how powerful this drug is, maybe compared to drugs that we've dealt with in this committee in the past. So we move on to the next page here. We've got lines 17 through 20. Again, we're increasing some of these penalties for the possession of fentanyl. As we move into section 2, we are looking at the trafficking of these fentanyls and other drugs and the minimums that go along with it. And if we go on page 3 here, this is line 41 on to 55. This is a section that has a very near and dear place in my heart. That is, it's not only wrong to traffic drugs in our state and sell them to our youth, but it is especially heinous when a criminal sells narcotics to those who are seeking treatment at our public and private treatment centers. And I think it is something that this body should take up to make sure that these folks that are predators on the sick are prosecuted accordingly. And so we increase those penalties on those offenders and those traffickers who decide to take advantage of these folks who are sick outside of these treatment centers and sell them drugs to get them hooked back on their addiction. With that, I can answer questions. However, I'm not going to be able to answer many of those detailed questions I heard earlier, which is why I have an expert with me. He can present, or I can take questions now, Madam Chair.
I do not see any questions from our members. D. Rollins, would you like to speak? Actually, I'm sorry. Representative Miller has a quick question.
I do. A very quick question. Thank you for your bill. I agree with you. Fentanyl is terrible. It is an awful, horrible plague on our community. Very dangerous drug to the user. My question to you is about the penalties. It has always been sort of my belief that the certainty of getting caught is more of a deterrent to criminal activity than mandatory minimums in terms of the sentences, the potential sentences, because most folks who are committing these crimes do not know what the penalties are. They just don't. They don't think about it. They don't know it. And so my question, I guess, for you is, what about making these sentences, mandatory minimum sentences, do you think will actually help us solve this problem of fentanyl abuse in our communities?
Well, I think it's twofold. And I think the first point I would say is that, A, you're right. Fentanyl is an entirely another class. It rises to a new level, one that I think the state, that this committee has never really taken up before. I think it's something that is an incredibly dangerous drug, and something that is not forgiving. It's not something that can be taken and then, maybe one administration of Narcan can fix. Maybe not 2 can fix, maybe not 3. And maybe this bill will send a shockwave to those folks. Last year, I remember on the Senate floor, there was an amendment to a bill that allowed for the local sale of test strips for fentanyl, so that those that are in addiction can actually test the drugs that they are using. There's not an absence of knowledge of what's there. There's certainly not an absence of the ability to have knowledge about the drugs that people are taking. And it's time that we take a responsible, measured approach to making sure that fentanyl isn't killing the kids in our state. That's mine. How do I think it's going to stop it? I think people are going to see this. I think people that are trafficking this drug and seeing the types of penalties are thinking now, you know what? It's relatively cheap to cut fentanyl in to heroin or cocaine. This is going to raise the price. This is going to raise it to a point where they say, you know what? If the people who are cutting these drugs in get caught, they're going to go away for a long time. And that's not worth me cutting this fentanyl in. So I hope it's an economics problem as well when they do that. I hope it's not only the fear of getting caught, but it's also the fear of economics. Because you got to understand, a lot of these drugs are not made, fentanyl on a large scale by individual users, but rather by drug cartels and others who are weighing economic factors and effectively economic penalties. And so I think that would be another factor that I would think about if I were in the manufacture of fentanyl or other drugs.
Thank you, Madam Chair. One follow-up question. Sure. Do you have any sense of any data or support for the idea that the sentencing in effect right now is not sufficient? In other words, that if a fentanyl dealer goes before a judge in this state, that they are not getting appropriately sentenced under the sentence structure we already have?
Yeah, absolutely. So that is the impetus of the bill. I mean, so I would say that we would not be here today without, as we all are representatives of the people that we represent back home. I am too, just as much as you are. I represent about 62,000 people. And we all work with our local governments, with our DAs, with our sheriff's office and others to come up with solutions that are going to work to make our community safer, healthier. And so this is not any different than anything else that you see. This is part of a teamwork and collaboration with myself and PAC and others to make sure that we come up with a good, responsible, metered way to make sure that we can keep this very dangerous drug. And I think that's got to be what when we think about fentanyl, you got to think of it as a poison. It's a killer. It's something that exceeds any other drug that we know of right now. And its pervasiveness and the cost of it is why it's so pervasive. It's a cheap substitute, and so we have to look at this bill with that lens. That fentanyl is a poison that's killing adults, youths, family members, and friends, and so that's why I have that bill here today. And I will say, the good district attorney here, Matthew Rollins, can have some, I think, chime in on that as well, because I think this is a way that we work as a team together.
Would you like to speak? We've got a few other questions.
Whatever, Madam Chairman, whatever you'd like.
Let's take one more question. Representative Byrd.
Thank you very much. Thank you, Representative Montahan.
Thank you.
I wholeheartedly agree that fentanyl is a bad thing, and family members have suffered from some sort of drug overdose. So, yes, it's an awful thing. With fentanyl, it is my understanding from a prior hearing that most cases it is cut with other drugs. So my question is, do you think this bill is going to help anyone that is trying to get a high, whether you're in high school or college or anywhere else? Are you going to ask if there's fentanyl in that drug before you purchase it if you want to get high?
Hold on, let me say your question again, because you said
So
I don't think we're asking drug dealers to like test and put it on the packaging. You know what I mean?
No.
We definitely don't want to test it and regulate it. We want to ban it. I mean, it's already banned, right? So certainly we want to but there is ways for them to test it. I mean, ultimately that bill passed here at the General Assembly last year. Whether I agree with that policy or not, you've got a way to test it, and folks need to know. I mean, when you're passing around drugs, or you're distributing drugs, or manufacturing drugs, and it's containing fentanyl, and you kill somebody, there's a responsibility.
I'm still trying to understand, though, if I'm a drug dealer and I have a whole bunch of pills and it has laced with fentanyl, am I going to go and tell someone that you want to get high, you want to purchase my pills or drugs? Would I be telling you that it already has fentanyl in it? And by knowing that I'm just kind of curious because the other representative's question is, will it matter to them how many years they're going to get in prison?
Well, you've caught me red-handed. I've never bought drugs before, so
No,
I don't know how that question and answer goes. Well, there may be somebody more qualified. You don't have to raise your hand in the room, but I don't know how the Q&A goes on that interaction. I'm so sorry.
I'm just.
You're very welcome.
Thank you. Chairman Smith.
I'm so glad to have one of my district attorneys here. I thought I was going to have two of you today. So, Jack, if you're out there in what I like to refer to as radio land, hello, I love you too. Let me ask you this, Mr. Rollins, and Representative Montana, feel free to jump in there. I see where you're going with it, and I like it. My question, just having looked through Code Section 16-13-31, and I know you've got other code sections in here, but just looking at this code section by itself, let me ask you this question first. This is basically like the methamphetamine pandemic, or I guess you could say pandemic that we had several years, or what, 30 years ago, 20 years ago? 20. I had a cousin who shall remain nameless that tried methamphetamine when it first came into our county. So is that, would you draw that equivalent between fentanyl and meth, Mr. Rollins?
I think there are a lot of similarities between the two in the fact of an epidemic situation. The potency of fentanyl is at a different level. Is the real concern. Obviously, there are a lot of concerns, but that is the one that's really hit us hard across the state, is the number of overdose due to the potency of that drug.
T.A. Rollins, can you put the mic closer to you? Thank you.
I apologize, Madam Chairman. So that would be the distinction that I would make, but yes, I would definitely draw corollarities between those two.
Okay. I was just looking at it, and just my only question is, it's a pretty extensive code section right there, and I just want to make sure, because I'm with y'all on this situation and this issue with fentanyl. I'm trying to think, by not just adding it throughout this statute is where you see methamphetamine and the amphetamine within it. Are we risking that we might be missing something?
Well, Mr. Chairman, Section 2, as you can tell, applies to multiple. It doesn't just apply to fentanyl, as it is dealing with trafficking of cocaine, illegal drugs, marijuana, methamphetamines. And Section 2 is, it was actually an issue raised, come out of Cobb County, where you can deviate from the mandatory minimum sentences in a trafficking case, but you weren't allowed. So if you were to give the mandatory minimums, that person would be eligible for parole and then the probated portion of the sentence. But if you were to deviate below the mandatory minimums, then they weren't being eligible for parole or any type of probated portion of that sentence. What this does is it addresses that particular issue to fix that problem by saying that no portion of the minimum term of imprisonment shall be probated, stayed, or deferred.
Okay.
I didn't. Yes, I apologize. I probably should have pointed that out before. That Section 1 is directly dealing with the fentanyl, whereas Section 2 is dealing with trafficking of controlled substances.
Okay. Thank you.
All right, Representative Miller.
Hi. Thank you for coming today. Just a sort of a practice question. You're currently a prosecutor?
Yes, ma'am.
Okay. Aside from raising these provisions to these mandatory raising the mandatory minimums on these drug offenses, aside from that, what do you believe, as a person on the front lines, would help you in your ability to sort of deal with the impact that fentanyl is having on our communities? Let's take mandatory minimums off the table.
Okay.
What is it that you think would help you do your job?
That's interesting. I appreciate the question, Representative Miller, and I wrote down some of your others, and I'd like to address those when the opportunity presents itself. But to answer that direct question, it's interesting. I'm confined to the operation, or to what we're allowed by law, and I think as the attorneys in the room, and I don't know if you're a practicing attorney or not. I apologize. I know you don't practice in Paulding. I can tell you that. Okay. Is the reality is that is where a lot of the treatment is initiated, is through the court system and through the criminal justice system. I'm all about access to treatment. I'll mention in a moment that people that are addicted to drugs, we don't send them to prison just because they're addicted to a drug. We get that treatment, but there has to be accountability for that treatment. Okay. So I'm all about greater access to treatment. I'm about the flexibility in what we can do during the probated portion of the sentence as far as the conditions to be placed upon there. Drug court is my favorite court, my favorite alternative court that we have in Georgia, along with mental health court. The flexibility to address those individuals' issues in that given case. So to ask me what the one thing is, there's not one thing, because it doesn't really match, and there's not a one-size-fits-all, in my opinion, for drug cases and how to treat that addiction.
Okay. The mandatory minimum punishment, that depends on the amount. Is that correct?
Yes, Madam Chairman, the minimum mandatory punishment, if it's for fentanyl, and it changes with the drugs, but with fentanyl, this would be 4 grams or more would be considered trafficking, and that's due to the potency of the drug, because as Representative Montahan stated earlier, 3 grains of salt can kill you if it's fentanyl, and that's why it's such a low quantity becomes trafficking.
Okay. Do you have a statement you'd like to make, D.A. Rollins?
Well, Madam Chairman, I'd just like to address some of the questions that were asked to Representative Momtahan. Okay, and I'll start, and the representative that asked that question is gone, but she had asked about whether or not individuals will try and determine if fentanyl is located in the drugs. And I want to talk about reality for half a second on that. Unfortunately, it is true, when somebody dies of a fentanyl overdose, people that are addicted to methamphetamines or one of those types of drugs, they seek out the drugs that were sold to that person because they're considered more potent, and they seek out those kinds of drugs. So yes, they do seek out, and they do recognize what actually has fentanyl in it. So there is that understanding, and so I wanted to make sure I pointed that out. Representative Miller, you had a couple of questions that I wanted to respond to, which were the certainty of getting caught, and how does mandatory minimums help in fighting this, as well as whether or not the current penalties that are in law actually address and help us deal with this issue. And it's looking back at the reality. And the reality is that for many individuals out there, that getting treatment and seeking treatment happens through a criminal justice system. It happens, and I've been a prosecutor now for over 10 years. I've been the district attorney, and before that, the acting district attorney for 2 years of the Paulding Judicial Circuit. And I've never seen anybody, we're not sending people to prison for 3 years or 5 years or 7 years for their first time possession of methamphetamines. I know that's a narrative that's out there, but it's not true. What it is a carrot and the stick. What we need to have is the ability to place these people on probation with those conditions that they receive that treatment. And when they go to that outpatient treatment, the drug and alcohol evaluation, treatment of screens, it's a standard condition, they fail. It happens. They're going to fail these in these situations. So the next step is we're now going to say inpatient treatment. Okay? Now, if that doesn't work, now we're going to take it up and we're going to say maybe RSAT. And then we're going to talk maybe drug court or one of those programs. But in order to have that supervision, in order to enforce that treatment, to ensure that the defendants are receiving that treatment to get off of these drugs, they have to be under sentence. Once their sentence has expired, I have no jurisdiction over them. I was speaking to a judge this morning who talks about the 3 years and how with a number of these defendants, they'll take a 3-year sentence because they know they're going to get out in 6 months. Whereas if they go into, let's say, drug court, that's a minimum of 18-month program plus another 6-month aftercare. And so there is no stick. There is nothing to encourage that defendant to get the treatment. So it's been said that this type of action is there to harm victims. No, this type of legislation is the legislation that saves their lives. By forcing the treatment, by getting them the help that they need, whether they recognize it or not, we're saving their lives so that they don't overdose later.
Thank you. I think we're going to hear from a few other people that have signed up. So thank you for coming.
Thank you,
to
Madam Chair.
First up is, I think it says Kate Bossia with National Incarceration Association. Okay. Thank you for
Thank
being
you,
here.
Madam Chair.
If you can tell us your name and where you're from.
Yes. Hi. My name is Kate Basha. I'm the CEO and founder of the National Incarceration Association. I'm a 30-year resident of Georgia, but more importantly, I'm the mother of a victim of fentanyl poisoning. My family's story is the American story. Everything you've talked about today has touched my life. Mandatory minimum sentences, fentanyl poisoning, substance use disorder. My life. My son died August 15th, 2021, in the city of East Point while in treatment. So, if you really think through this bill, my point is if mandatory minimum sentencing worked, my son went to prison on a mandatory minimum sentence for armed robbery in Fulton County. He had no weapons, stole nothing, hit nobody. He was in a frat party fight. He got caught up in the letter of the law. My family got caught up in a system that doesn't really understand what it's doing. The 15 years that he was sentenced to, he did 6 based on the law that allowed the judge to give him a little less, a little leeway on that mandatory. He had no treatment. He could not get into RSAT, with all due respect, because there's not enough resources in the state of Georgia in the Department of Corrections. My organization works with hundreds and hundreds of families impacted by this very topic. If mandatory minimum sentences worked, then we wouldn't have any drug addicts. If my love was enough for my son, we wouldn't have any drug addicts. If RSAT worked, people would come home healthy and whole. We have recidivism rates with staggering numbers, 30 to 40% recidivism, predominantly because we do not repair, restore, and rehabilitate a human being while we detain them. We don't do that. Y'all pretend we do, but we don't. So in conclusion, I just want to say, this bill joins the American legislative culture of reacting to our fears and even our anger. I know what it feels like to be angry, very angry, because someone made money off of my son's addiction and my son's death. But I and we have an obligation to eliminate problems, not just react to them. A bill such as this, so as it's crafted right now, will surely put more people in prison. That's a fact. We will be locking up a whole lot more folks. Prisons that are riddled with drugs and gangs. But it will do nothing to reverse the organized and sustained and conspicuous habits of the people who killed my child. I am willing to spend time with any legislator to discuss what getting to the foundation of this problem really looks like. So with respect for every mother like me, I urge opposition to House Bill 253. Thank you.
Thank you for coming, and sorry to hear about your son. Thank you so much. Next up is Robin Elliott. I understand there's 3 of you. Do you want to separately speak? Okay, thank you. If you can say your name and where you're from. Thank you.
My name is Robin Elliott. I am one of the co-founders of Georgia Overdose Prevention. My son Zach died on May 1st, 2011 of a heroin overdose. He was 21 and he was my only child. I am here in opposition to House Bill 253. There is no one who wants to stop overdose deaths more than I do. My son was sold drugs that killed him, and that has forever changed my life. I believe this bill is a step backwards. We all remember the government's efforts over the last 30 to 40 years to try to arrest our way out of a drug problem. And all that has done is filled our prisons and our jails with low-level drug dealers with long sentences. It has unfairly filled the jails with disproportionately minorities and low-income people. What we've seen in other states that have passed a drug-induced homicide bill is that the people that get arrested are not the major traffickers. They are people that are getting high with their friends or have sold drugs to their friends or a family member. And if the premise of this bill is to stop manufacturing and stop trafficking drugs, history shows that incarceration is not the answer to that. We are not going to incarcerate low-level drug users and stop trafficking and manufacturing of drugs. I worked diligently with a grassroots group to pass the Georgia 911 medical amnesty and expanded naloxone access bill in 2014, which was sponsored by Sharon Cooper. Our organization, since then, has formally educated more than 52,000 people throughout the state of Georgia on the 911 medical amnesty bill. We educate people that they should not be afraid to call 911 if they're at the scene of an overdose, because if they call 911, they will not be arrested, charged, or prosecuted for personal use quantities of drugs that may be at the scene. We have been told, we do presentations all over the state, and we've been told over and over by people that come up to us and say, "Thank you, you saved my life." My friends called 911 because they knew they could. I have so many friends, mothers, so many mothers that are friends of mine whose children were dumped on their front lawns, who were left in cars, because the people that were with them before our bill was passed were afraid to call 911, and so they just left and hoped that the person would snap out of it, but they didn't. They died. The number one best way to prevent overdoses is for a person at the scene to have naloxone and to feel comfortable calling 911 to get help for that person. That's the number one best way to prevent overdoses. That didn't happen before this law, and it didn't happen for my son. Think about it. Peers use together. Someone brings the drugs. And are we going to say that that person should be arrested if they have personal use quantities of drugs and they happen to be the one that brought them and gave them to the person with them? Should they go to jail for 3 years, 7 years, 10 years, 20 years, whatever based on what the quantity is? We will revert back to how things were before the 911 law passed if this bill is passed. House Bill 253 will not prevent deaths. It will cause more deaths and more mothers who will feel the way I feel. I urge you to say no. I oppose. Thank you.
Thank you. Cheryl Shepard. Thank you for coming.
Hi, my name's Cheryl Shepard. I'm from Douglas County. And my son, Bill, died 6 months or less than 6 months after the amnesty bill was passed. Nobody knew about it at the time. I didn't know about it. Or I feel like his life would not have been lost because the amnesty bill was there and he could have gotten naloxone. So after that, I was started volunteering with Georgia Overdose Prevention. Going all over the state. When we first started, I would ask everybody if they knew about the law and that they could call. It's probably the first thing I asked most people before they did. And now they do, because we have worked all these years to finally get it where people are comfortable enough to call 911 for the people they're with. Just Saturday, our Douglas County RCO responded to 6 overdoses because they called 911. And every one of those lived, like my son could have. And now, if we do this, they're not going to call. We've had to change the culture. The culture was, if you're doing drugs, you're on your own. We're finally making progress, and this is going to undo it all. And there's verbiage in here that it applies to purchase, possession, even marijuana. It mentions the 4 grams, our bill, or their bill that they worked so hard to get passed. The amnesty is up to 4 grams. This says they'll be sentenced to a minimum of term of not less than 3 nor more than 7 years. So it completely contradicts the law that's already there to get people to call. Just even Sunday, not counting the ones that in my county, but we had 8 people report that they used Narcan to save somebody's lives. You know, the numbers that she gave, that's just what our organization does. There are so many others that are out there doing the same thing. You know, we've had almost 8,000 reported reversals. There's got to be, they're not being reported, all of them. So those are lives that have been saved because people called 911. There's going to be lives that will not be saved if y'all pass this law. You'll be killing them.
Thank you.
Please vote
Thank
no.
you for coming. And Miss Lewis, is it Lewis? Laws, I'm sorry. Laws.
Hello.
Hi. Thank you for coming.
Thank you. My name is Jill Pickett Laws. I live in Atlanta, Georgia. And on November 27th, 2013, my 17-year-old daughter died of a heroin overdose. She was a soccer player. She got kicked in the face 5 times, got hooked on liquid Loratab, and then it led to heroin. I, at that time, met Robin Elliott and was involved briefly with the 911 amnesty and whatnot. It's a date I'll never forget, and I believe that what these great ladies have done is really saved lives in these past 10 years. It was passed in April of 2014. Since then, my daughter's younger brother, who was 15 at the time, was a drug user as well. He did really well. He came back to Atlanta and did horrible. So at the age of 19, he took more Xanax than you could imagine, went to a Walmart, got a pellet gun, went to a vape store, robbed the vape store, and got 15 to 8 years. My son is serving in the Georgia Department of Correction at this time. He can get more drugs in prison than he can on the street. It is unbelievable, unfathomable. I never thought in a million years that I would be dealing with both these issues. I met Kate Boccia when because she was real involved in Georgia Overdose, and I gave her a call. I go, Kate, you're not going to believe it. I'm in this club now. So as we work through it, people are dying of drug overdoses in prison all the time. The fentanyl's in there. It's the strips, as you may or may not know. So my question is, if this bill passes, who are they going to prosecute the people that are bringing the drugs into the prisons as well? That's my story. Thank you.
Thank you so much for coming. And I think our last person signed up for this is Ms. Travis.
Good afternoon, members of the committee. It's hard to go after those speakers. I want to ask you to consider taking Section 2 out of the bill out, because what you're doing is you are completely eliminating any discretion that the judge may have to grant leniency in criminal justice reform, which feels like bad words to say around this building some days. The legislature created the ability for the district attorney to impose a reduced sentence for under trafficking laws in the instances where the prosecutor could demonstrate to the court that the defendant was not the leader of the criminal conduct, that they didn't use a firearm, that they didn't cause death or serious bodily injury, that they had no priors, the interest of justice would be the interest of justice will be served, if you do less than a mandatory minimum. Section 2 of this bill completely eliminates that aspect of leniency for not just fentanyl, but for every drug. Marijuana, cocaine, and obviously drugs are illegal and should not be used. But eliminating that aspect is a huge swipe in this instance. Section 3 of the bill, there are a number of places in the law where we say you can't sell drugs, you can't possess drugs. The code sections are like near public and private schools, housing projects, parks, and drug-free commercial zones. I'm looking at 16, 13, 32, the point 3456. The problem is this bill, if you look at line 45, it references 37-7-80, which is a code section that allows for any state or state-operated facility to be designated by the department as a treatment facility. However, this bill doesn't, there's no way to know where a treatment facility is under the way that this is currently written. I understand you're trying to prohibit sales of drugs near a treatment facility, but the way the bill is written, it applies to private and public facilities. The cross-reference is to something that is only public. There's if you look at the code sections that are in the 32 point something, there's a lot of distinctions of what should be made to make it clear where those kinds of activities should be prohibited. And with regard to Section 1, I don't think I really can say anything more than the ladies that preceded me. Mr. Corso is here in case you guys have complicated questions I can't answer.
I don't see any questions. Thank you.
Thank you.
Okay, and Representative Montahan, if you can come up, and I'll just give you 3 minutes to just give a quick response.
Well, I'll give a 30 seconds. I'll give the remainder to the DA. We were talking about and listening to the testimony, and you don't have any reminders. Well, no, I don't need that one. We're talking about the different things, and my heart goes out to these families who have lost loved ones. Obviously, we are trying to do something about that today. I will say that there is we talked about the personal use of drugs. We talked about fentanyl. I have here in my hand some sugar. If you'll find 3 grains of that sugar, that's enough to kill you. 3 grains of what I just spilled out right there, if that were fentanyl, is enough to kill you. This is the problem that we have. This is not cocaine. It's not heroin. It's not marijuana. It's a incredibly potent, strong poison that's getting cut into drugs where young adults all across the state are putting it in their bodies and they're dying. And a person can have Narcan. They have it on them. But if they don't have 2, 3, or 4, it won't never bring them back. That's how powerful fentanyl is. That's why we're here today. I don't like to do mandatory minimums more than anybody else. But something's got to change. 2 overdoses a day in Paulding County with a population of 160,000. We've got 11 million Georgians. 3 grains. That's what I posit for this committee. Something to think about. And I'm going to, the rest of my time, I'll give over to D.A. Rollins.
Madam Chairman, does he have any more time?
That's fine. I'll give you about a minute if you have a brief comment.
I do. Just briefly, the medical amnesty law was spoken of, and I feel we're all on the same side on this issue. This bill in no way affects that. This doesn't take away the medical amnesty law and the ability to call 911. But the argument that Narcan is the best way to avoid overdose is, I'm sorry, but an overdose has already occurred. The Narcan prevents you from dying from that overdose. What we're trying to address is before you get to that point and get the treatment that is needed for these individuals before it ever gets there. The next one was the leniency. That section 2 is dealing with traffickers of fentanyl, traffickers of illegal drugs, and I'm sorry, I'm not going to be apologetic about this. As a prosecutor and district attorney and see the effects that drugs have, especially fentanyl, I have no qualms in saying I don't believe leniency is appropriate for people trafficking drugs in this state. And then finally, Section 3, yes, it does apply to public and private treatment facilities, and that's because something was brought up earlier. We don't have enough government-funded or public treatment. We have to rely on private treatment facilities who can provide the treatment that we need for these individuals.
Thank you. Okay. I don't see, do we have any questions, members? I don't see any questions. Do we have any discussion from members? And before I take up a motion, this is a very, very tough subject. Thank you for sharing your stories. Thank you for coming and testifying. And at this time, what's the will of or do you have a question? Do you have a discussion? Okay. Representative Miller.
Thank you, Madam Chair. I did want us to recognize the moms who came in today to share their experiences. Nothing that happens in this room is meant to diminish that grief and that loss in any way. And so I just want to make sure that I say that to you out loud. And I do have this is a difficult issue for me because I understand both sides. I was a prosecutor as well for a long time. And I have been away from that world and have seen our criminal justice system from the other side now, representing individuals who have substance abuse problems and who oftentimes are charged with things like possession with intent and sometimes trafficking when they are themselves addicts. I do believe that there is a place in our criminal justice system to deal with certain drug offenses. But I think that substance abuse is a social problem that is complicated. And I think the reversion back to mandatory minimums, I fundamentally do not support. And I understand that we might be having a motion here soon today. While I understand the intent of my colleagues' bill, it will not be a bill that I can support.
Thank you. At this time, I'm going to hold. We're going to come back to it. I know we're holding one more as well, and we're going to hear a few other bills here. Thank you. Thank you for coming. All right. We have few other bills that we're going to hear, and then we're just going to hold few bills for now.
So is there a time frame for that?
We're correct.
or you can stick around.
Thank you. Thank you for coming. All right. Next bill we're going to take up is Chairman Smith's bill, House Bill 334. Chairman Smith?
Thank you, Madam Chair. Just for the sake of not having to move all over the place today, I bring before you House Bill 334. Should be working off of LC number 480800. I want to thank everybody that helped work on this. Appreciate Wade Askew and everyone at Georgia Justice Project, as well as GACDON. I appreciate PAC's input on the bill as well. I always enjoy the good discussion with my friends. Just a little bit of a background. 3 years ago, we enjoyed the full legislature support, as well as a coalition of businesses, faith groups, and nonprofits to pass Senate Bill 288, which introduced record restriction and sealing to Georgia convictions. House Bill 334 offers minor adjustments to the current law to make it work better for more people. This will really be seen as a positive economic and public safety impact, actually giving some more effect to Senate Bill 288. And I'd like to note that it's supported by the Georgia Chamber of Commerce, Metro Chamber, and the Small Business Majority, as well as a few others. Just so you know, as far as the success that we're building on by making the current law work better, it would do it in 3 ways. This would clean up a lot of the unintended obstacles that prevent eligible individuals from accessing relief, trafficking survivors, non-fingerprintable offenses, and pardon offenses. Somebody forgot to turn that phone off. It'll remove barriers to misdemeanor restriction and sealing. It would do so while still requiring 4 years of conviction-free history before someone is eligible to apply. I should note that this 4-year mark aligns with what we know about recidivism, which has been studied very, very extensively, and that data is well available to all. That if someone goes through 3 to 5 years without an arrest, they are typically no more likely than anyone in the general population to be arrested again. Let me repeat that. If someone goes through 3 to 5 years without an arrest, they are typically no more likely than anyone in the general population to be arrested again. House Bill 334 would remove these barriers while maintaining the prosecutor's right to object to relief and the judge's discretion whether to order restriction and sealing. Also, there is open access to the courthouse for retroactive first offender relief. RFO is what I'll refer to it, so I don't have to slow the process up how slow I talk. RFO is a distinct form of relief that currently has a very unique requirement that prosecutors must consent to an individual filing a petition for relief. This bill addresses that basic due process concern while maintaining the ability of a prosecutor to object to relief and a judge's discretion to grant or deny RFO. So, in essence, Madam Chair, that is the bill, and I'll yield for any questions. I'll find my copy of the bill here in the stack.
Thank you, Mr. Chair.
Glad to.
Doesn't seem like we have any questions for you, but we do have a few people signed up to speak. I'll call up Wade Askew first.
Good afternoon. Thank you, Madam Chair, members of the committee. I'll be very brief because Chairman Smith covered it better than I could. My name is Wade Askew. I'm the policy manager at Georgia Justice Project. We represent about 1,700 individuals a year in their quest to seek record restriction, whether giving advice or representing them fully or partnering with prosecutors throughout the state to create summits to help folks access relief. And so in our experience over the last 2 years since the enactment of SB 288, we've seen just a number of barriers that folks have run into. What this bill is intended to do is to remove those barriers to really let 288 work to the full intent of the legislature, which voted on it unanimously just 2 years ago. So we know record restriction works. That's why the business community is so behind this. It raises wages an average of 22% within the first year of restriction. It reduces recidivism. There's a study showing within 5 years of record clearance, folks are only convicted of a felony less than 1% of the time. So less than 1% of people who get record restriction are actually convicted of a felony within 5 years. So it reduces recidivism. It's a boost to the economy, and frankly, we need this in a time of workforce shortages to get more qualified individuals into the workplace. And I also just, last note, want to say record restriction comes with some of the strongest employer liability protections in the country. The legislature made sure to do that 2 years ago. So again, another reason why the business community is so behind this, because we're taking individuals who are motivated to get to work. Almost every individual who contacts Georgia Justice Project does it because they're trying to advance in their career, they're trying to get a job, and they're having challenges. And so that's what we're trying to do here. Thank you.
Thank you. You have a few questions. Is that Representative Byrd?
Thank you very much. I just need, since I am a non-attorney here, I want to be sure I understand where you're asking. So someone that has a record, you are asking for, in this bill, that their record be restricted so no one has access to the information that they are a felon. Is that correct?
So thank you for the question. So this bill does not structurally change existing law very much at all. So right now, record restriction is limited to certain misdemeanor convictions, and then for felony convictions, it's only available to folks who have already gotten a pardon from the state. This doesn't change that. And so what record restriction and sealing does is for folks who are applying for employment or housing, things of that nature, to say if they went through this judicial process, which involves notice to a prosecutor, a judge using their discretion whether to issue restriction and sealing, that record would be restricted in its access for those parties. And so the lion's share of individuals that this would be affecting are just have conviction histories of misdemeanors. And as Chairman Smith described, those old records are just that, they're old, because there's a requirement that someone has gone 4 years conviction-free before they're really even eligible to get into the courthouse. If I've gone only 3 years without a conviction, if my conviction's 3 years ago for whatever that misdemeanor was and it's an eligible misdemeanor, I'm stopped at the door because I haven't met that first basic box of eligibility. Once I've hit that 4-year mark, then I can get in the door, but a prosecutor might object and say, we don't think it's appropriate in this case. And then it will be heard by a judge to make that decision. So hopefully that, I know that's a quick overview of a large amount of law, but I'm happy to clear up anything.
Sure. I have a follow-up, please. So I need an example here. So if I have a home that I want to rent, and I need to do a background check on someone to be sure that the neighbors and everyone else is safe. So someone who has committed a misdemeanor, I don't know, there's a lot of things that fall under misdemeanor, if I remember correctly. Their record would be restricted, so I would not have the ability to see that they had been a misdemeanor, charged with a misdemeanor or a felony. Is that kind of sums it up or not?
That does sum it up. I mean, most of my explanation is on kind of how narrow a universe we're talking about that restriction and sealing is available to individuals to petition for. And again, it builds on what we know about recidivism, that if someone has gone those 4 years that's required by law without an arrest, then statistically they're no more likely to be arrested again than anyone in the general population. And so, I should also note that even I briefly described for felony cases the very, very narrow path that folks have available, which is getting a pardon first. Only about 500 pardons are granted a year by the State Board of Pardons and Paroles, and even those who those who are convicted of a serious violent or serious sexual offense, even if they get a pardon, they cannot get restriction and sealing. So serious violent felonies, serious sexual offenses, there's nothing you can do to access restriction and sealing right now in the state of Georgia.
Chairman Gunter?
I think you may have just answered my question. The child molester still on his sentence, got the minimum or got the mandatory minimum of 25. Maybe they're 15 years into it, no arrests previously, but that record's still available for employers and people that want to rent something to them.
That's right. That, those serious offenses aren't eligible for restriction and sealing, even if a pardon has happened. For those non-serious, violent, non-sexual offenses that are felonies, even to get a pardon, you have to be 5 years done with your sentence. So, those protections are already in place. But those most serious cases, there is no path to restriction and sealing.
And if they've been arrested and convicted in some maybe serious drug problem in the past, maybe they've completed their sentence, that's cut off. Nobody can see it.
Well, they would have to, after they've completed their sentence, then, we're talking about completing the waiting period, making a petition to the court. This is an affirmative process. This is not an automatic process. And so that they have to initiate that affirmative petition-based process where there's notice to prosecutors.
But that's to get that. But if you're, after you've, I guess, so you go through that process and you get that, and then an employer in the future can't see that.
If you have gotten that restriction sealing, if that has been granted, then correct. If restriction sealing has been granted, then, like I said, most employers then would not have access. I say most because there are carve-outs for things like law enforcement, schools, elder care, FDIC requirements, things of that nature.
Well, I'm thinking of the nursing home hiring somebody that had an opioid addiction in the past.
Right. So nursing homes, those types of entities, there are carve-outs in current law that they can see relevant convictions. And so, to be clear, 334 would not be affecting any of these things. 334 would, 288 kind of in the process to build that out a couple years ago, all these considerations were made. And so those concerns are kind of protected for in 288. 334 isn't really touching those, very, very, those more sensitive situations and kind of the basics of what restriction and sealing does.
Okay, thank you.
Thank you. That's all the questions. Thank you for coming.
Thank you.
Megan Middleton.
Good afternoon, Senators, Chair, and Senator. Sorry, I've got my head out. Representative, thank you for bringing this bill. And representatives and members of the committee, I want to thank you for allowing me to speak. I will be brief. My name is Megan Middleton. I'm the Director of Government Affairs for the Atlanta Community Food Bank. We service 29 counties from South Metro area all the way through Northwest Georgia. And right now our distribution rates, just to give you some facts and figures, are up 40% from pre-pandemic rates. So we are still seeing a lot of people in need in the food security area. In addressing food insecurity at the food bank, we look at that issue in a holistic way. And one way we look to address it is in areas where people can get more employment, get better employment, get into housing and other areas to get better access to healthy and convenient food sources. So as a result, the Atlanta Community Food Bank has put on our advocacy agenda this bill, House Bill 334, and so that we are in support of this. We are in support of helping people who have been rehabilitated to get better employment, and that will just open up those other avenues to them. So I'm not going to get into the legal aspects or any of that, but I did just want to speak on the record that we, as a different organization, you've heard the business communities behind this. We're also behind this and join Georgia Justice Project and Representative Smith in support of this bill.
Okay, great. Thank you. You don't have any questions. Thank you. Okay, any discussion by the committee? Good. Okay, I'll take up any motions.
I move we do pass.
All right, any second? All right, and all for House Bill 334, say aye. And those who oppose, say no. Okay, House Bill 334 is passed. Thank you. And House Bill 126 by Chairman Smith.
Thank you, Madam Chair. Appreciate the committee's indulgence. I tried to make sure we got to many of everybody else before we ever took mine up. So I bring before you, Brian, I know we've changed the LC number on it. Which one are we working off of this time? We've changed this thing, and I want to tell every interested party thank you for morphing this into the bill that it is today. LC number 480887S. What I would like to do at the outset, however, is tell y'all that I'm going to offer an amendment to this sub here today. But to just give you a little background, we had a couple decisions that we needed to clarify that an available avenue of relief would still be provided for co-defendants, and really doing with out-of-time motion for a new trial. I know that Gactel can speak to this, but really this is an effort that we wanted to make sure that when there was no other relief afforded to a defendant, that they would be afforded an out-of-time motion for a new trial or out-of-time notice for appeal, and that they would have the right to file that said motion. So in essence, that's the bill. I'd like to bring up Jill Travis on this. She's worked diligently on it, and so if that's okay with the chair.
Yes, that's fine. Ms. Travis? Ms. Travis, go ahead.
Good afternoon, members of the committee. I bring with my come up here with partner in crime, Brandon Bullard, who does a lot of appellate work. He's located here in Atlanta, and thank the chairman for sponsoring this bill. This bill is a reaction to two Supreme Court decisions that were made in the last couple of years. Section 1 of the bill deals with a decision that I know that Representative Byrd can understand this. It's legal, but it's not complicated. When you have a trial in a case and there's multiple counts in the indictment and the jury is unable to reach a verdict in some of the counts, when the trial ends, the prosecution can proceed weeks later or months later, whatever, and to try to prosecute the charges that a verdict wasn't reached on. Or they can dismiss the charges. Or they can place the charges on the dead docket, which is a really kind of arcane term, but they place the charges on the dead docket, and at that point, the Supreme Court held in the Seals decision that you cannot appeal. The defendant is in limbo, is stuck. Now, are there other ways that the defendant could appeal? Yes, they could ask for an interlocutory appeal, but that's up to the judge. And they could, what was the other way they could do it?
At this point, a few things could happen. If they could ask for an interlocutory appeal, but they have to have the permission of the trial judge before they could take that appeal. They could try to persuade the prosecution to move to null pros those charges so that they're dismissed and the judgment becomes final, and then they could take an appeal. Or in the third instance, let's say if it lingers too long, eventually they might without a trial or without some resolution, they might try to attack those charges through a constitutional speedy trial motion, something like that, to get rid of them. But until those charges are resolved, appeal is not possible under our code as it is currently written.
So, Section 1, very simply, solves that tiny issue that when the prosecution dead dockets those charges, we go forward we're able to go forward with the appeal. Section 2 was added to the bill because we did work with the Prosecuting Attorneys Council on this bill. Section 2 of the bill would allow, in the instance where somebody is a pro se, usually it's pro se defendant, but they could be represented, but they want to file a notice of appeal from their guilty plea, that they would be required to do that by application. They couldn't just file a notice of appeal. So it gives more flexibility for the prosecutors in arguing against those direct appeals from a guilty plea. Section 3 of the bill deals with a case that was decided in March of last year. And what it did was it did away with about, 30 to 50 years of jurisprudence, wherein it was the law of the land, not your law of the land. It was the law of the land based on judicial decisions that you could file an extraordinary motion for new trial when you missed the deadline. And I know everybody is like, well, how could you miss the deadline? Everybody knows when the deadline is. It happens. It happens for a variety of reasons, and especially in these circumstances, when you're dealing with criminal cases, you're dealing with sometimes somebody that's represented by a retained lawyer at trial, and then they're not represented by. Then it goes to the public defender's office, and there's transition. I'm not saying that there's any good reason for it. I'm just saying it just happens, and so through the law, we've always had this animal we called an extraordinary motion for new trial or an out-of-time appeal. Out-of-time motion for new trial. We call it various and sundry things, but it all results in the out-of-time appeal. In March of last year, the Cook decision came down and said that, yes, everybody, we had all this law for all of these years, but we're doing away with it because it was not statutorily created, and the legislature can fix that. And I could read very many words from the opinion about telling the legislature that you have the ability to fix that. And that's what this does. It fixes it. And it says that with the consent of the state, if they want to agree, some of you might remember Andrew Fleischman, who was here with me a few weeks ago. He missed he missed a deadline on appeal because he addressed the envelope incorrectly. So maybe the prosecutor would agree. We can have an out-of-time appeal by showing excusable neglect, which is based on the federal rule, and there's a 4-pronged test on that. I'm not going to go into those details. By
Ms.
showing
Travis,
it,
if you can wrap it up.
okay.
Thank you.
Deficient performance or good cause shown. That's Section 3, and Section 4 of the bill was added at the request of the prosecutors with respect to amended motions for new trial, which can be done in civil cases and in criminal cases that the prosecutors wanted to make it clear that the state should be given time to respond and present evidence when the defense brings in other evidence, an amended motion for new trial.
Okay, thank you. I don't see any questions, and I will take up the next speaker. Thank you.
Thank you.
Oh, hold on. Chairman, yep, you're good? Okay. Thank you. Robert Smith, thank you. And you are with PAC, correct?
Yes, ma'am.
Okay, go ahead.
And this is one of those times when Mr. Bullard is my colleague. We're used to having a green, a yellow, and a red light to indicate how much time we have. And I imagine right now, sitting down, my light's already on yellow. This committee has an opportunity tonight to do one of two things. You can do the fair thing, which is give the defendants who were co-defendants and had the door closed behind them in Cook, give them an opportunity to get out-of-time relief. Or you can do that and then create a brand new process. And that's what this bill, the bulk of the bill in front of you does, is create a brand new process. It says that criminal defense attorneys can't count to 30, unlike civil attorneys. So we have to give you 180 days or a year after conviction or after the denial of a motion for new trial to give you your right to appeal while your client is in the DOC, in the Department of Corrections system, and unable to communicate or unable to figure out who the public defender is. It gives the prosecutor the ability to say, we got surprised by this 18-page motion for new trial at the beginning of a motion hearing for a new trial, so please give us time to respond. It does some very good things. From my perspective, it also does some things that I'm not overly crazy about. Ms. Travis and I have had a lot of back and forth about this bill and the merits of it. But one of the things it boils down to, the one thing that it needs to do more than anything else, is it needs to be fair. The example is if you have a defendant, three co-defendants, A, B, and C. A and B were able to get in between that narrow window of Collier and Cook. In that narrow window, when there was an out-of-time appeal or an out-of-time motion for new trial, A and B were able to get their guaranteed right to appeal through. But C, for whatever reason, was not able to get their right through. The fair thing is to give C that privilege and that ability, and I think that's part of what this bill does. Everything beyond that is new process, new procedures. There's some things I'd like for you to do in there, and consider that, and I don't know, because I haven't seen the chairman's motion and the substitute, I don't know how far he goes and what he does. But the one thing I will urge this committee to do more than anything else is do the fair thing and give those co-defendants who didn't get a chance to have their appeal heard, give them that ability, that one-time shot to be able to have their out-of-time appeal heard. That's the fair thing to do. Everything else this bill does is procedure and creating a new one. And by the way, when Ms. Travis was talking about having 5 charges or having multiple charges and some of them being dead docketed because the jury got hung, there was a case that came down, I believe last week or the week before, called Gonzalez, and said that the state still, in the trial court, the court that makes where the jury trial takes place, still has jurisdiction. So if the state comes forward and says, hey, we want to, trial court, would you please let us have the ability to take those charges off the dead docket and dismiss them, so that way the person's appellate right ripens, they can still do that. We still have that ability. So those are my remarks, and I'll be happy to answer questions. And like we say a lot of times up here, we haven't seen the substitute, we haven't seen the perfected thing. So
Thank you. Chairman Leverett.
I just have one quick question, just so I understand. Ms. Travis referred to extraordinary motions for new trial, and the bill seems to refer to out-of-time motions. Are those the same thing?
No, sir. Our law actually recognizes extraordinary motions or things like when somebody is in prison and says, hey, there's DNA that needs to be tested. We've heard
So it depends on the grounds of the motion?
Yes, sir.
Okay. Thank you.
An out-of-time appeal means you've missed the 30-day deadline.
Okay. Chairman Gunter?
Thank you. What about in those cases where the ADA gets really busy and they don't get back to pulling the cases off the dead docket that are left over, and so this person can't appeal? You understand what I'm talking about?
Yes, sir. And remember, the motion to take off the dead docket doesn't have to be granted. It's a motion that has to be made, but it's still left up to the trial court.
It's got to be made by the prosecutor.
It can be made by anyone.
Okay. But I mean, who's going to have an interest in getting it done?
Both sides. But yes, the state's the one who would, in theory, be making the motion, but the pressure's going to be put on by the defense.
Okay.
And if we want to have a conversation about dead docket reform, I'm happy to. The problem is that there's only a handful of jurisdictions where you actually have a dead docket process. I've practiced in 1 or 2 jurisdictions, 1 or 2 circuits, where if I came back with if I had a hung jury, the trial court putting something on the dead docket is done by, as Your Honor knows, is done by the discretion of the judge. I have to ask permission to put something on the dead docket. And there are some jurisdictions when you get a hung jury, the judge would look over at me and go, okay, where's your dismissal? You aren't given the opportunity to dead docket charges.
Yeah. It was quite popular in the Mountain and Enola circuits, I can tell you.
Okay. Thank you, and that's all the questions.
All right. Thank you.
And Chairman Smith, I understand you did mention that you have an amendment. Would you like to speak to it, Chairman Smith?
I do. Chairman Gunner and I talked about this bill at the very beginning along with Gackel, and we had an understanding about the bill and both in favor of it. I think this morphed into a little bit more than what our original understanding had been, and I get that there's some very amicable aims in this. However, I have some concerns about some of the excess and do think that we need to parse this down back to what the judge and my original understanding would be. So what I would propose here to the members of this subcommittee is to strike everything starting at line 11 all the way down to line 44. And right after the comma there in line 45, the comma before A, starting with that A, by the way, strike from the A in line 45 after that comma there, A defendant, starting with A defendant, strike all the way down to where the word motion is in line 49, inserting in its stead the following after that comma. Any defendant whose co-defendant was able to challenge their conviction through an out-of-time motion for new trial or out-of-time notice of appeal shall have the right to file another motion. That's what we would put there, and so basically you're reduced down to this paragraph, which would now read right there starting at line 45 if this amendment were to pass. I'll read it for whole just to make it all come together. In a criminal case, after a judgment of conviction, any defendant whose co-defendant was able to challenge their conviction through an out-of-time motion for new trial or out-of-time notice of appeal shall have the right to file another motion seeking an out-of-time motion for new trial or notice of appeal until June 30th, 2025. So that's the first amendment I would make. And then I think to make that make sense, and Judge, if you'll, and Robert, if you could direct me on this for this to make sense, we would probably need to strike from line 51 down to line 58 as well. Yep, if you want to come forward on that.
Go ahead.
Mr. Chairman, I didn't understand. I might have misunderstood. Are you striking the beginning part of the bill too?
Yes.
Okay. Then yes, anything 51 on would also need to be struck.
Okay. All right. Then I propose also that 51 through 58 would be struck as well. And this aligns with what Judge Gunner and I had first spoken about. It's my understanding. Judge can correct me if I'm wrong. I know that was a lot to throw out all of a sudden, but I know we spoke briefly about it.
All right. Chairman Gunner?
Thank you. All right, let me make sure I'm understanding what your amendment is. So I got a defendant who's seeking an out-of-time motion because a co-defendant got an out-of-time motion granted, regardless of the individual's history of a appeal or not. Am I correct on that?
That's correct, yep.
So they can already have an appeal, and then an out-of-time motion goes through by one of their co-defendants, and they can file for another out-of-time appeal?
That's my understanding, Judge.
Okay.
And for the Madam Chair, just for the sake of time, what we can do is we can give everybody a thought. I'm sure we'll have another meeting or two before two, and we can let everybody chew on that one so we can get on to other business.
Okay, we will do that. I think we have a few questions to answer and with that amendment, so we'll go ahead and hold this one as well. Give me 1 second. We held 2 bills earlier. I'm going to go back to House Bill 487. Is Chairman Newton back? Okay. Now, I know we've heard from you, and we've heard testimony on this as well. Sure. And I don't remember the question. Do you remember which, was it Representative Miller?
Yes.
Okay. And can you
had asked
repeat the
about-
question?
It was the question regarded who was included in this, and did it include physician offices and things like that, or was it hospitals? I did look up the chapter, Title 31, and Chapter 7 that's listed in the legislation that makes it pretty clear that it's hospitals, rehab centers, imaging centers, and then it specifically says the term institution shall exclude physician and dentist private office and treatment rooms where physicians and dentists primarily see and consult with patients. So it does not include physician offices, which includes urgent care centers, by the way. Those are they're not licensed. They're so it's just hospitals, rehab, true medical facilities.
Okay. Thank you. Representative Miller, do you have a follow-up to that? Okay, great. Thank you. Do we have any other questions from our members? All right. Do we have any discussion on this bill? Do we have I'll take up any motions at this time. Okay. Okay. We've got a motion and a second to pass. All those in favor say aye. And all those who oppose say no. Okay, Chairman, it's passed. Thank you. All right, that concludes my subcommittee's calendar for today. We're going to take a 10-minute break, and then we'll come back for the full non-civil calendar. Thank y'all.